Hi, I'm Peter Cole. I'm the chief of the Division of Pediatric Hematology and Oncology at the Rutgers Cancer Institute of New Jersey, which you can see behind me. I'm also the vice chair for the Children's Oncology Group Hodgkin Disease Committee. And I'm happy to talk about what's exciting in new agents, particularly in immunotherapeutics for children, adolescents, and young adults with Hodgkin lymphoma, focusing really on the work that we've been doing in the Children's Oncology Group, testing new strategies for this patient population. So the first, of course, to talk about is brentuximab vedotin, an antibody drug conjugate targeting CD30 on the Hodgkin-Reed-Sternberg cells. This is an agent that we've been really interested in for about 15 years now. It was first approved in adults based on data, the pivotal phase 2 trial showing very high single agent activity in that population. In the Children's Oncology Group, we showed that brentuximab vedotin can be safely administered in combination with conventional chemotherapy. Our trial, the COG trial AHOD 1221, tested the combination of brentuximab vedotin with gemcitabine in patients with relapsed or refractory disease. And we showed, just like in the adult context, that there was tolerable toxicity. And we showed a complete response rate of 67% in this highly refractory population, which was higher than what we would expect from either of those two drugs alone. Notably, 2 patients stayed on treatment for up to a year without undergoing autologous stem cell transplant. So a good response and a durable response from this combination of therapies. So just like in the adult oncology world, we're now looking at whether brentuximab can be used in upfront therapy, replacing conventional chemotherapy for children and adolescents with Hodgkin lymphoma. In our trial AHOD 1331, we tested whether we can substitute brentuximab for bleomycin within the context of ABVE-PC therapy. It was a randomized phase 3 trial. It accrued 600 patients, including 90 children below the age of 12. And the study closed in 2019. We're still waiting on the readout. We're excited to know whether brentuximab improved outcomes for those patients. So the next class of drugs, compounds that we're really excited to bring into the context of treatment for children with Hodgkin lymphoma are the checkpoint inhibitors. These have clearly shown great promise in adults with relapsed and refractory disease, and showed single agent activity in a trial in the Children's Oncology Group for patients with relapsed Hodgkin lymphoma. We brought this class of agents, we used nivolumab into the clinic in a clinical trial, AHOD 1721, which is also called Checkmate 744. This was an international phase 2 trial. We used nivolumab in combination with brentuximab, the antibody drug conjugate, for patients with relapsed or refractory disease. And we again showed a very high response rate by blinded independent central review. The complete response rate to this combination was almost 60%. And when we added in an intensification with brentuximab plus bendamustine for those who did not achieve a complete response rate, the complete response rate to the whole regimen was 80%. So this is very exciting. We were able to, without much conventional chemotherapy, get a big proportion of children with a relapsed or refractory disease into a complete response and able to go on to auto transplant. So just like with brentuximab alone, and just like what's being done in the adult world, we're now bringing this class of treatments into the upfront context through a series of clinical trials. We're participating in E4412, which is actually another relapsed or refractory trial using nivolumab with brentuximab compared with a triplet, nivolumab, brentuximab plus ipilimumab. And we'll be testing which of those two regimens can produce a higher response rate. And then in the upfront setting for newly diagnosed patients, we're using another checkpoint inhibitor, pembrolizumab, in AHOD 1822, testing whether pembrolizumab can add to ABVD for those who don't have a complete response to the first two cycles, asking whether that will improve the response rate. And we're participating in the SWOG-led trial S1826, comparing a nivolumab plus AVD or brentuximab plus AVD. So substituting again for bleomycin within ABVD, comparing nivolumab, a checkpoint inhibitor, with brentuximab vedotin, a antibody drug conjugate, looking at progression-free survival as the primary endpoint. So to summarize, there's a lot of excitement in the pediatric oncology world about bringing these new classes of agents, new immunotherapeutics into clinical trials for children, adolescents, and young adults with Hodgkin lymphoma. We've shown already that these agents can be safely combined with conventional chemotherapy and with each other with a high response rate. And we're excited now to test whether these agents can be brought into frontline therapy, replacing cytotoxic conventional chemotherapy with the hope that will improve cure rates and decrease toxicity.